And now we're going to hear about how abortion has politicized medicine and science. Our speaker is Dr. Bryon Calhoun. He's a diplomat board certified by the American Board of Obstetrics and Gynecology in general OBGYN and in the subspecialty of maternal fetal medicine. With over 25 years of clinical experience, he has authored over 700 peer-reviewed articles in obstetric and gynecologic literature, presented over 100 scientific papers, participated in over 40 research projects, and has published numerous articles. Dr. Calhoun serves as professor and vice chair in the Department of Obstetrics and Gynecology at the West Virginia University, Charleston. He continues to actively practice maternal fetal medicine, educate residents, students of all disciplines, perform diagnostic obstetrical ultrasound, and participate in prenatal diagnosis counseling. Dr. Calhoun will address how abortion has politicized medicine and science.
Well, I'd like to thank you very much for inviting me to speak here. I'll also give you my disclaimer. It's 70 publications, not 700. Thank you for amplifying that. It's 70 peer review. I'm also going to give you my disclaimer that I'm speaking on my own behalf today, not on the behalf of West Virginia University, just so we're clear on what's said here today. I'd like to be able to talk about the politicization of science and of abortion and women's health. And I think that I'm fortunate to have lived in both epochs, both pre-Roe versus Wade and also after Roe versus Wade. And I deal every day with the results of these, of the legalization of abortion in my clinical practice. Therefore, I speak with some authority on this issue. I hope to expose today the broad thread, as I call it, scientific chicanery, if you will, in elective abortion research and science. I'd like to discuss this critical issue in the context of four myths: the myth of neutrality, the myth of the fact-value distinction, the myth of there is no bad abortions, and the myth that there's no conspiracy of silence. And I like the idea of Alice through the looking glass. So if you'll indulge me, we'll make a little journey together. For years, there's existed a fantasy, I call it, of neutrality in the science, particularly when women's health care is involved. The myth is proclaimed so loudly now that it is a given dogma akin to an urban legend. However, unfortunately, the truth has a very nasty habit of breaking through in fantasy, doesn't it? No one would dare openly admit that each scientist and physician brings their own peculiarly held views to every scientific fact and finding and the implication thereof. Our analogy from Alice that best fits this myth involves Alice and the Cheshire Cat, one of my favorite. Alice says, "Would you tell me, please, which way I ought to go from here?" And the cat answers, "Well, that depends a good deal on where you want to get to." And Alice says, "I don't care much where." The cat said, "Then it really doesn't matter which way you go." So the gist of this neutral scientist argument belabors the concept that all ideas carry equal weight, and no particular viewpoint is superior. It's as if a blood pressure of 200 over 120 in the stroke range will make no difference whatsoever to an individual compared to a blood pressure of 120 over 80 in the normal range. Of course, no one in medicine would ever allow someone to have an elevated blood pressure, since we do know that untreated hypertension leads to medical complications. Not so with elective abortion. The truth of the effects of abortion on the clinical science or on the patient has no bearing whatsoever on the participation or the care in abortion. Finally, the last thing, what's most telling of all actually, is that one's views of abortion are simply one's choice and are sort of void of any sort of underlying value system, are neutral. One may choose to engage in abortion or not, depending on your particular taste. One may like chocolate ice cream and find it appealing, or one may like vanilla ice cream and find it appealing. It's just your preference. That is in spite of the courts and the science that admits that abortion has significant unique characteristics, including the loss of life and companionship of children and complications to women's health. Well, what about the fact-value distinction idea? Or shall we say that which is scientific and is able to be done by empirical evidence alone is the only true truth or only thing knowable? This false dichotomy says that only that which is scientific is knowable and hence amoral, and that in science or in ethics or morals, it's not knowable since they're not scientific and not fact-based. Unfortunately, you're hoisted on your own petard, if you will. Science itself rests upon the very concept that we're actually able to know truth, know facts, record truth, and record true facts, and come to a conclusion about such facts. The abortion myth would suggest that the loss of the baby in violation of a moral truth of not murdering does not affect a woman or her health because it's just one of many neutral, non-value related choices. As certain as the laws of gravity affect on a person who jumps from a bridge, so are the certain the effects that we've seen on women's health on the person who violates a moral law in taking the innocent life. To quote Alice again, lovely. Curiouser and curiouser, cries Alice. Well, what about the myth of no bad abortions? And I'm sorry to say that my own Congress of Obstetricians and Gynecologists, the National Cancer Institute, the Center for Disease Control, and Department of Human Health and Services all steadfastly refuse to acknowledge any adverse effects of elective abortion on women. They just won't do it. And so what we see, however, is, in spite of that, is the opposite. Let's talk about the things that actually are a result of abortion. Increased maternal mortality with abortion, true fact. Increased risk for preterm delivery, over 134 papers of which I've attached to your packet. Increase of mental health issues, which we've seen by Dr. Shuping. Increased risk of breast cancer, true risk of breast cancer with the first pregnancy and probably other pregnancies, as Dr. LaFranchi's talked about. All four of those things are the bad outcomes of abortion, are scientifically based in multiple papers on good science, not junk science, and they're not my papers. You gotta love it. Well, what about poor choice or the conspiracy of silence? Tut tut, says the Duchess. Everything's got a moral if only you can find it. Well, is there really a choice for women without addressing any risks? How informed can you be if you're not told of something? Again, we're in fantasy land, so it's all okay. ACOG has refused to list, publish, or acknowledge in any publications of any complication of elective abortion related to maternal mortality, preterm birth, psychological effects, or breast cancer. They will not list them. The refusal of journals in the United States, in particular, to publish virtually any articles that are critical of elective abortion. Go look online sometime and see if you can find them. Or see if you get them published, even more importantly. Try. Refusal to allow any discussion at national meetings, including the American College meeting, which I go to every year, at any level regarding elective abortion complications. You won't find one discussion of it, of the complications of it, about any of the things we've discussed. Not one. The refusal of DHS, CDC, NIH, or NCI to advocate, provide, collect, or properly report on elective abortion procedure numbers, procedures by weeks gestation, procedures by types, surgical and medical, complication of rates by abortion weeks, type, or maternal mortality. Not one of them advocates for that. Oh, we have electronic medical records, the best thing since sliced bread. They're going to save us, and they will not put any of this elective abortion thing in there. None of it. Refusal, again, of DHHS and CDC, NIH, or NCI to advocate or develop a means for collecting this national data. Put it in the national record, then. Why don't you put it in the national record? On the most common elective surgical procedure performed in the United States, over 1.2 to 1.3 million a year, and over 50 million, no statistics. All the CDC statistics are junk. So what has poor choice done for us, as I call it? Elective abortion is a healthcare disaster for women. Elective abortion has cost us over $1.2 billion in preterm deliveries alone. Pretty soon it's starting to sound like real money, $1 billion and billion. Yeah. Elective abortion's true risk has been suppressed to the detriment of women's health. And I like Edmund Burke, not just because he's Scots-Irish like me, but because he's true. He says all that's necessary for evil to triumph is for good men and women to do nothing. And I'm closing with that. The most beautiful grandchild in the world is Penelope Calhoun. Thank you very much.
I think it just goes to show you why women who have had abortions and who are suffering from the pain of those abortions and who are regretting abortion for their entire lives are now speaking out. Because when the evidence is suppressed, as has been pointed out today, who else is going to speak? So you will find that more and more and more women are coming forward and being bold and sharing those stories, no matter how difficult it is for them to share it, because they want justice to be done for those babies and for other women in the future. Well, I'd like to ask Dr. Bush, if is that right? To make sure I'm getting the right people here. Excuse me. No, Alan Parker and Janine Maxon, if you wouldn't mind, come back up. Join Dr. Calhoun. We'll take a few questions, if you have any, for these fine folks. Any questions at all?
For Dr. Calhoun, what did you mean when you just said a moment ago the CDC, all CDC statistics are junk?
When you get abortion statistics, they are voluntarily given, and the majority of the larger states, particularly California, doesn't even report them. So they estimate them every year. And in fact, there's many years, it's even a lot of states, maybe 10, 15 states report nothing to the CDC. It's a voluntary project, so all of them are estimates. So when Guttmacher does their statistics, they rely on the CDC, which will tell you on their website they're not reliable. By the way, if you look at them, they'll tell you they're not reliable because they're not complete. So my plea is please talk to our legislators and talk to people, get a true electronic record and get the real data, like they've done in other countries, and show that this is a disaster for health care for women.